Welcome. This is Anna Stiefvater at the State Public Health Division. I'm here with Adrienne Green, and this webinar is Safe Sleep in Oregon, Guiding Conversations with Families. So we're thrilled that there were a lot of registrants from a lot of different places. We have home visitors that were registered in different home visiting programs throughout the state. There's DHS staff, both from child welfare and self-sufficiency. And so this is a big group, which we're thrilled about. But because of that, we've placed you all on mute so that we can make sure that this is a good experience for everybody. And we're excited to have people from sort of different disciplines across the state join us, because the part of this work is really about families hearing the same message. We know it's really confusing for families when they hear sort of mixed messages from, say, a home visitor or someone in self-sufficiency, and a different message from their provider, and then a different message from their mom. So we're doing our best to sort of get the word out in Oregon about what the recommendations are, and hopefully that will be helpful in increasing the safety of our babies in Oregon. Okay, I'm just going to run through a list of housekeeping items. So you would not be able to hear this if you weren't doing this, but you can only attend this webinar, the audio portion, by using your phone. So you need to call into the number. And like I said, we've been placed on mute. We want to hear from you, even though I said we placed you on mute. We would like to do our best to make this sort of interactive to the best that we can. So if you have questions or comments, things that you would like to share with the group, please go ahead and type them in the questions or chat box. And we have both Michelle and Carrie here that we work with in public health that are monitoring those, and will answer them or bring them up for the whole group. And we are recording this. So we're recording it, and we'll make the link available as soon as we can kind of edit and get it put up on our website. And we will send you an email that will give you directions for receiving a certificate of completion if you would like one of those after the webinar. So you could use the certificate of completion to share with your supervisor if you wanted sort of just a record that you attended today. We also made sure that this presentation meets the requirements for the Oregon Registry. So some of you are probably familiar with the Oregon Registry's pathways for professional recognition in child care and education, and it records and recognizes the professional development, growth, and achievement of people who work with children and families. So you could also use this certificate towards recognition in the registry. And then you should be able to access the handouts. We uploaded those as part of the webinar, and so you should be able to get to those now. Okay, and these are our objectives for the next hour. We're hoping to sort of cover these things, and that you'll be able to say that you know how to do these things by the end of the time here with us today. And this is what our agenda will look like. We're going to start with a reflection activity, and we're going to end with some action planning. And really, the idea here is just that we can give you a few minutes to sort of think about how you can apply what we discussed today, sort of if there's any new content or things you already knew but have some new ideas about how to implement them in your practice. We just want to give you a few minutes to do that. And this webinar is scheduled to end at 3 o'clock. Wrap it up by then. And just acknowledgement that the Safe Baby Sleep Initiative in Wisconsin has developed a lot of materials. It's sort of a comprehensive initiative, and we borrowed from them with permission. Okay, so here's our reflection activity. Just want to encourage you to take a few minutes to reflect on these 3 questions. And we know that many of you already have some knowledge about safe sleep recommendations. Some of you may already be expert in what these recommendations are. And many of us have our own personal experiences around infant sleep. So we just want to have you take a few minutes. You can either jot them down, or if you're watching with a group, you could share with your coworker. Or if there's something you'd like to share with a larger group, you can chat it into the questions or the chat box. we'd just like you to spend a minute or two reflecting on these 3 questions. Okay, thank you for taking a minute to do that. Now I'm going to turn it over to Adrienne Green, and she will be providing an overview on the data and some definitions, and then going into the 8 safe sleep recommendations that we want you to know about.
Thanks, Anna. So today we're primarily talking about the sleep environment in this training, but it's important to understand other key causes of infant death or mortality. If you look at this bar graph, you'll see that Oregon's rate of infant death is generally similar to the U.S. rate, which means we're similar to most states. Prematurity or preterm, babies born too early and often too small is the #1 reason for infant death. Babies born less than 5.5 pounds are at a higher risk for infant death. And birth defects, which are congenital anomalies and complications of mom's pregnancy, the perinatal conditions, are other causes. These deaths often occur in the first month of life. Once an infant reaches 1 month of age, the most common causes of death are called sudden unexplained infant death, or SUID. And this does include SIDS, the sleep environment, and other sleep-related deaths. In Oregon, we have about 40 to 50 SUID deaths annually. So one question was brought up that if the #1 reason for infant death is prematurity, why are we focusing on safe sleep? And although much work remains as we work on reducing prematurity, but once a baby is born, prevention is a priority. So safe sleep environments, breastfeeding, and not smoking are the top prevention actions we can take around safe sleep. So I'm going to discuss what SUID is and then kind of go into 2 slides after that, one describing what SIDS is and one describing what this accidental suffocation and strangulation in bed, ASSB, definition is as well. So sometimes the titles used around infant death can be confusing, and we're hoping that the next few diagrams can help clarify. So SUID deaths are sudden unexplained infant deaths that occur in infants less than 1 year of age and whose cause of death is not immediately obvious prior to an investigation. Sudden infant death syndrome, SIDS deaths, are a subcategory of a SUID. And a death is only categorized as SIDS if the cause of death cannot be explained after a complete, thorough investigation of the death scene, a complete autopsy is performed, and a review occurs of the clinical history of the infant and parents. In Oregon, we have a medical examiner system, and most of our SIDS deaths are correctly classified. Another subcategory of infant deaths in a sleep environment are suffocation and fall under ASSB, or accidental suffocation and strangulation in bed. These deaths are preventable in most cases. Part of educating families is to help them view sleep-related deaths as preventable and not a mysterious phenomenon outside their control. So the next 2 slides will discuss SIDS and ASSB. So SIDS, well, unsafe sleep practices are a risk for SIDS. So we're going to talk a little bit more about what puts an infant at risk for SIDS and what is shown to help in preventing it. There's not one definitive cause of SIDS. It is believed several factors called the triple risk model. Vulnerable means there is an underlying defect or brain abnormality that makes the baby vulnerable. Certain factors such as defects in the brain that control respiration or heart rate or a genetic mutation can increase vulnerability. The other circle there, critical development period, refers to the infant's first 6 months of life when rapid growth occurs and changes in homeostatic controls occur, such as breathing, sleeping, heart rate, and blood pressure. The third ring there is outside stressors, and those are things in the baby's environment, such as secondhand smoke, overheating, sleep position or surface, or an upper respiratory condition. Although these stressors are not believed to single-handedly cause the infant death, they may tip the balance against the vulnerable infant's chances for survival. This model above helps us understand kind of the vulnerabilities babies have for SIDS. So the next definition is ASSB, or accidental suffocation and strangulation in bed. So the mechanisms that lead to suffocation include soft bedding, for example, a pillow, or it used to be long ago, waterbed mattresses, anything that's soft that can cover an infant's nose and mouth. Overlay, for example, when another person rolls on top of or against the infant while sleeping, and this can also include animals, dogs and cats in bed. Wedging or entrapment, for example, when an infant is wedged between two objects, such as between a mattress and a wall or a bed frame and furniture. And strangulation, for example, when an infant's head or neck become caught between crib railings, or it used to be through if they were in a crib, they could get hung up by the drapery strings or pulls, or around this, or clothing items, any strings around the like a sweatshirt pull. So to reduce SUID in Oregon, we've come up with 8 sleep recommendations, and I'm going to walk you through those 8 slides that you can use to promote safe sleep to your families. So the first slide is around sleep position. This slide shows the increased risk and decreased risk to infants related to sleep position. Placing a baby on his or her back is the most effective action parents can do to reduce SIDS and SUID. So the next slide shows the sleep position about putting babies to back to sleep, and the discussion around choking. So it used to be we thought that we would keep them, we would keep them from choking on their spit up if they were on their stomachs. But what we have found that babies were at higher risk for suffocation. When we put them on their side, we found babies didn't stay on their side and rolled one way or the other. After research and studies, we found that babies sleeping on their backs is the safest. As you can see, the trachea, airway, actually lies on top of the esophagus. So when a baby spits up, gravity will keep the spit up in the esophagus, and it will either come out of the baby's mouth or he will swallow it. Either way, the trachea is protected when the baby is on their backs. Also, placing the baby on the tummy doesn't allow the child to breathe in fresh air. Since the Back to Sleep campaign started in 1992, we've seen a reduction of 50% in infant deaths. New parents often hear from grandparents and others that their baby slept on their tummy, and this is part of the conversation you will have about, over time, how we've learned new information. For example, are a good example to use. While many of us survived never wearing a seatbelt, we wear them now, and we would agree that if we were in a car crash, our chances of surviving are much greater wearing a seatbelt. So on this next slide, we really do want to talk about tummy time just for a moment. Babies do need tummy time to develop different muscles in their developing and growing bodies, but it should only be when they are awake and supervised. Tummy time also helps prevent a baby from getting a flat head, and it allows a baby to experience their surroundings from a completely different vantage point. So our second recommendation is around sleep surface. This slide actually discusses the impact sleep surface has on SUID. We know that babies that sleep on soft surfaces, such as couches, pillow top beds, pillows, and comforters, are at risk for SUID. To reduce this risk, the American Academy of Pediatrics recommends a firm sleep surface with a fitted sheet and no other loose materials in the area, such as pillows, toys, blankets, bumper pads, or even bags of diapers. So sleep surfaces can vary depending on cultural tradition, space, and mobility. The most common surfaces are a crib or a pack and play or even a baby box. Cribs today should contain a firm mattress, only 6 centimeters of space between the rails on the crib, no drop sides on the crib, strong hardware and tough testing, no bumper pads or stuffed animals, blankets, pillows, or loose baby items. Pack and plays also should have a tight-fitting sheet free from items mentioned. Just want to make a note that almost all cribs were recalled probably 5 or 6 years ago, and the newer models don't have drop sides, and the railings are small enough that a baby's head can't fit between them. But you can Google the Consumer Product Safety Commission, which is cpsc.gov, for more information and a list of recalls on any baby cribs or baby products. So alternative sleep surfaces have been around for a very long time and were introduced to address concerns and desires expressed by families, such as how can parents sleep near their baby but keep them safe? In 1937, Finland had an extremely high infant mortality rate of 65 deaths for every 1,000 births. The government passed the Maternity Grants Act to help decrease the high rate. Originally for families in poverty, the grant provided every newborn infant with the basics so that he or she would have the same start and chance at life as other infants in higher economic families. The program now gives every baby a box, no matter what economic class. The kit includes a box for the baby to sleep in, along with other necessities such as clothes, diapers, etc. Once Finland's babies started sleeping in boxes, their infant mortality rates dropped to 3.38 deaths for every 1,000 births. No matter what container is used, as you can see in a basket, a box, a carton, a wash tub, or even a drawer, the surface must have a firm and flat mattress. A changing pad, for example, could be used in the bottom of a container as long as it was not fluffy and was tucked in and secure. Our third recommendation is around sleep location. This slide discusses where the baby should sleep in the home. Again, the AAP guidelines are built around the promotion of breastfeeding, bonding, and safety, so keeping baby close to mom allows for each of those to occur and has been found to be a protective factor to have the baby near. Science is clear that breastfed babies are at a reduced risk for sudden and unexpected infant death. However, we do recognize not all babies can or are breastfed, and this does not diminish the importance of bonding and safety. Adult beds have lots of risk factors in them. There are a variety of soft pillow-top mattresses which do not support infant necks. A baby on a soft surface is at an increased risk of cutting off their airway if their heads roll forward or sideways or are hyperextended. Most adult beds also have pillows and blankets, which could easily suffocate an infant. And babies are not coordinated enough to move a blanket or a pillow off of their face. And we do know that babies less than 12 weeks old are at higher risk for SUID in an adult bed than older infants. This time period is especially hazardous for infants. So sleep location. In Oregon, we like to say face up, face clear, smoke-free, and baby near. Temperature during sleep. Parents often think babies need to be kept warmer than themselves. Again, based on the triple risk model that we showed earlier, this could be an environmental stressor that increases the risk of an unexplained infant death. We have learned that babies can become overheated and as a result are at risk for death. Sleep sacks are great because the baby is adequately covered and avoids the risk of a blanket. And healthy babies do a good job regulating their own body temperature. We recommend that babies are dressed in no more than one layer more than an adult would use. So our fifth recommendation around the caregiver. The behavior of the caregiver is particular concern in regards to SUID. Parents who are extremely tired or come to bed late, have had a few beers or drinks before bed, are taking medication that makes them sleepy, or are smokers put their infant at a higher risk for SUID, especially in the first 12 weeks, as we mentioned. Since most parents are extremely tired with a newborn and may be on medications, placing the child near the bed, near the parent, but not in the same bed, is protection to the infant against SUID. Our sixth recommendation is around smoke-free environment. Research shows that cigarette smoke is linked to SIDS, even if the parents don't smoke but live in homes with others who smoke, even outside smokers. The link to SIDS is pretty clear. We recommend that caregivers and relatives not smoke around a baby. Seventh recommendation is around breastfeeding and pacifier use. Research has shown that 2 of the protective factors against SIDS, breastfeeding and pacifier use once breastfeeding has been established. And our last recommendation is to share the message. It's important that parents share this information with other family members and caregivers. Babies learn to sleep in a certain way. If a baby is used to sleeping on their back and is then put to sleep on their tummy, they are 4 times at risk for SIDS. Babies do love consistency. So I will now turn it back to Anna, who will review some of the recommendations and then go into some information about talking with families.
Thanks, Adrienne. So since Adrienne just shared a lot of information, both the data and then sort of the 8 recommendations that we feel are the most important for you to know, I just thought I'd pause and ask Carrie, Michelle, is there any questions or comments that we should address now?
We did have one question about whether or not the OHA will have all of these points available in Spanish. And we shared that we do have some informational materials in Spanish, but not the presentation.
Right. So I will, in a few slides, kind of go over what resources we do have. And for families, we do have resources that are available in English and Spanish. And actually, we've had quite a few requests for materials in other languages, things like a poster and a brochure. So we're kind of working our way through our process here to see if that's an option. And at this point, we don't have this presentation available in Spanish, although it sounds like maybe that would be something we could work on too, as well.
Another question that popped up, have vaccines been linked yet to SIDS? Have the babies who passed from SIDS, did they look at when their last vaccines were enforced?
Okay, so that was a question about a link with vaccines and SIDS, and there, at this point the research shows no link between actually either getting immunizations or not getting immunizations and SIDS. We've really shared with you what we know about the science, and the recommendations that we are sharing with you are sort of based on what we know of the science to date. Okay, so feel free if you have more comments or questions to continue to chat that into the questions or the chat box. And then I'm going to ask everybody to take a second and try to chat in or use the question box and answer this question: is this baby safe? Well, actually, I'll tell you the answer. So we think no, this baby, there are some risk factors here. But I guess I'd like to hear from people. Based on the recommendations that Adrienne shared, can you identify some risk factors or something that you think poses a risk to the safety of this baby? Just take a second to sort of chat that in. I think I'll ask Carrie and Michelle to read off a couple of those.
Yeah, we have quite a few that have come in. Thank you all. Side bumpers, crib bumpers, the bed lining, question mark, and the drop down side.
Okay. So the main thing that we wanted you to be able to identify was the bumper pad. So it sounds like people definitely did that. I think we wanted to sort of point out that on first glance, this looks like a safe environment for a baby, I think many people think, or it looks like something we see a lot in the media. So lots of media still has pictures of babies with bumper pads and blankets in some cases and stuffed animals. But part of, I think, our job is to make safe sleep look like the normal, to sort of get people used to what it looks like for a baby to be sleeping safely, which is in a crib without the bumpers. And I can't tell if this is a drop side crib, but those do have some risks if that's what it looks like. Okay, I'm going to go to the next one. Oh.
There's only one more question, but it has to do with pacifiers.
Okay.
So tell me about pacifier use. How do you encourage people to use a pacifier and not have issues getting rid of the pacifier later in the year? What is the actual science behind pacifier use?
Okay. So this question was about sort of the science behind the recommendation around pacifier use. And I think what we know about the science is that a baby sucking on a pacifier, I guess basically isn't in as deep of a sleep as other babies. So there's something about it that kind of keeps the baby a little bit awake. And so we recommend not starting a pacifier until breastfeeding is well established. So that's usually about 3 to 4 weeks for babies. And then as far as taking away a pacifier, I mean, the recommendation for using a pacifier, all of these recommendations around safe sleep are really only focused on babies that are less than 1. So we're sort of talking about babies that are less than 1. We know that the greatest risk factor for SIDS is actually less than 6 months, but these recommendations still apply until they're 1. So definitely after age 1, there wouldn't be any benefit as far as protecting the baby from a SIDS death by using a pacifier. So you could talk to a family if they were using a pacifier because of that, you could talk to them about age 1, about that protection would no longer be there.
I have a clarifying question about that, Anna. So if a baby refuses to take the pacifier and will not take one, will they have more of a chance than one who will take a pacifier?
Okay, I assume that means an increased risk. Yeah. So yeah, some of these, the two protective factors, so the two things that we know that are on the protective side are breastfeeding and pacifier use. And so there is, and then there's all the risk factors. So I think it's a part of what you're doing is talking about making sure you can eliminate the risk factors that you can, and then we're acknowledging the protective factors. So we know, especially when we're talking with families, there might be a number of reasons babies don't want to, or the moms don't want them to use a pacifier, and same with breastfeeding. I mean, we know breastfeeding is really important for the health of babies for a lot of reasons, but for whatever reason, that might not be something moms or babies are doing. So I guess what we're trying to say is that the science shows us that these are some things, the protective factors against SIDS and SUIDS death. And then we know that there's certain risk factors as well. Okay, so I'm going to ask you all to chat back in around this baby. Does this baby look safe? And again, based on the recommendations that you just learned about, are there some risk factors that you can identify? And I'll just give you a minute or two to do that. And Carrie, do you want to share what people are saying?
Sure. We have a lot of folks saying caretaker looks tired, mother fell asleep holding the baby is not safe, co-sleeping and the baby is on their stomach, not a flat surface, possibly impaired caregiver. Also fall.
Yeah, great. Yeah, that is, thank you. Thank you for everybody. Thank you to everyone for chatting in. That is another risk, the fall risk. What we sort of really wanted to highlight here is that the recommendation is that babies sleep in a crib or a pack and play or one of those alternative surfaces that Adrienne discussed every time they're asleep. And I think we're learning more and more from talking with families that emphasizing that every time they sleep is important. So we don't want babies in couches and chairs, in beanbag chairs. We know that those are dangerous when babies are sleeping. Okay, and one more. What about this baby? Can you identify a risk in this baby's sleep environment? All right, Carrie?
All right, we've got a lot of answers for this one too. Looks like baby's on a soft bed, sleeping on his stomach, sleeping with mom, so co-sleeping, has a blanket, not a firm surface, a pillow is close by.
Great. Yeah, I think you got them all. So this is great to hear that people are kind of seeing this, because I think lots of people would see this baby and think that he looks fairly safe. But yes, so the in bed with an adult is something that's not recommended. The blanket, the being on the tummy, sleeping on what looks like it could be soft bedding and near a big pillow. Those are some of the risk factors. All right. Thank you. Okay, so now we're going to spend a few minutes talking with families. So we're just going to go over some strategies that you can use as you have conversations with families about where their infant sleeps. So first, it's important to learn and acknowledge a family's culture, religion, and traditions. Our goal in talking with families is to respect and value the beliefs of each family while assisting them in thinking about ways of maintaining their culture and their tradition while ensuring that their baby is safe. For example, we know in many cultures it's traditional to sleep with your babies, but we also know that today our beds are soft, they're pillowy, and they're different than beds that may have been a part of traditional culture. So this may be an opportunity to offer a small crib that's positioned next to the bed or an alternative sleep surface, and that might both meet the family's needs, respect their culture, and keep their baby safe. And we know that it's important to listen to families and understand why families may not be embracing these recommendations. So part of our job is to get information out about what the messages are, but we also need to approach conversations with families, listen to their questions. We need to reaffirm that we're hearing them and understanding that the family's circumstances. So there are a number of reasons listed here that describe why families might not embrace these recommendations. And in order to really keep babies safe and help motivate behavior change, it's important for us to understand what some of these barriers are for families so that we can talk about them. Okay, so many of you I know have already received quite a bit of training in motivational interviewing or have incorporated this into your practice or your work with families already. And so this is talking with families about safe sleep is another opportunity to apply those techniques. So you can think of this in sort of 3 steps, focusing on sort of 3 simple steps as you talk with families. And this might be an approach that you're already using when you're talking with families about other things. So you just want to remember first that you and the parent should be guiding each other's conversations. So this is where you want to be asking open-ended questions, really understanding the family's circumstances. You want to be affirming their feelings. You need to follow with what the parent says. So if they say, you know, I know about these recommendations, but I'm not doing this because of this, you can't sort of, you need to sort of acknowledge that. Because I think in developing relationship with families, wanting them to hear our message, we have to sort of affirm those feelings. And then we want, as you educate families, with the information needs to be given in a constructive way to the parents. And so here are some examples of open-ended questions, ways that you can start conversations with families. And you are welcome, if it's helpful for you, to just use these. You can just take a couple of these that make sense to you and start having conversations with families if you're not already. So some examples of the questions are, what has your mom or other family members told you about sleeping with your baby? How do you feel about where your baby should sleep? How is your sleep arrangement working for you? Tell me about a typical day at your house, or tell me why it is difficult for you to get your baby to sleep. And I'm sure many of you have your own open-ended questions. If you wanted to go ahead and, if you have one that you feel like is worked well for you or is a good question, please go ahead and chat that in, and we'll share that with the group. The open-ended questions sort of acknowledge that families already might know something about safe sleep or have their own sort of thoughts and feelings about it, and sort of respecting that. And then as you try to provide education and share some of the recommendations, this is just, again, some language that you can use. The first bullet point, I guess, is really directed to those of you that work with DHS. So you could say, in partnership with Public Health, we'd like to talk with all families with infants about safe sleep. This sort of normalizes it. You're not specifically talking with certain families about safe sleep, but these are recommendations that we're trying to share with all families. Or something like, these are the things we know that will help keep your baby safe during sleep. And then just a reminder to avoid the use of shoulds. I think we all know how that feels. So hopefully sharing the recommendations in this, using some of those motivational interviewing tools, will allow you to do that.
We did have one open-ended question that someone wrote in. Shirley shared, what does safe sleep mean to you, as an example.
That's great. Thank you for adding that to the list. Okay, and barriers that come up. So these are examples of feedback that you might hear from families, and I just wanted to sort of walk through how you might be able to respond to some of these. So for the first one, the parent is acknowledging the safe sleep recommendations. Sort of, I know putting my baby to sleep in the crib is the safest, but they're questioning their ability to utilize the crib. So you just want to find out more about that and discuss the barriers. The most common response is that the baby doesn't like their crib, because every time the parent puts the baby down, they wake up and cry. And this is, an opportunity to talk to families about babies, and that they have a startle reflex, and that when they fall asleep in their parent's arms and are laid down on a firm surface, that startle reflex is triggered, and the baby will wake up and cry. So that might help, sort of understanding sort of some of the science might help people understand why they're getting that reaction from their baby, and that's not necessarily that the baby doesn't like their crib, but that this is sort of a reflex. And you can suggest placing the baby to sleep in the crib before they're completely asleep. You can suggest sort of rubbing or patting the baby's tummy or other parts of the baby to help soothe them to sleep. Another concern might be that families feel that they won't be able to bond with their baby if their baby's sleeping in a crib. And again, a reminder that there's lots of opportunities for bonding. You want to bond with your baby when you're holding them, while they're feeding them, when the baby's awake, when you're wearing the baby in a baby carrier, playing with the baby during tummy time on the floor, or you can be having again, putting the baby in the crib and patting them or rubbing the baby's tummy while they're in the crib. And also, since the recommendation is to have the baby near you, having a crib or a bassinet right next to the parent's bed, they can easily sort of reassure their baby by singing or touching the baby. And then this, my mom said, my friend said, we know that there's lots of conflicting sort of advice and information given to parents about lots of things, but including where their baby should sleep. And so this is just a great opportunity for the mom to educate their family and other care providers about the current guidelines and recommendations. And a reminder, as Adrienne said, these recommendations are fairly new. So this, for some people, this is actually new information. And you can say something about how we're continuing to gather new information. We have data that really supports these recommendations, and we're trying to get that word out to everybody. So that's especially important for families to share with any caretakers that are watching their babies. Okay, so these are some of the tools that we have available. So this brochure that you see a picture of, Safe Sleep for Babies, this is available in English and Spanish. It is at this the Public Health Safe Sleep webpage. You have the address there. And I'll give you a contact information on our last slide. If you'd like to order, we have hard copies of those available, or they're things you could print yourself. There's also the Oregon Prenatal and Newborn Resource Guide, so that's like a book, and it's also in English and Spanish, and it has one page on Safe Sleep where it shares these recommendations. That's a great resource for families in general. And then our web page where we have some information and some resources. So that's a good place to go. All right. I think we've kind of reached the end here and we're ahead of schedule, so we have plenty of time for questions, but I do want to encourage people to take a minute and think about these questions. So this is sort of the action planning phase. We want you to either, again, you can chat this in, you can write it down for yourself or talk to a coworker if you're with somebody else, and just think about how you can apply what you've learned as you're working with families. And then if there's support that you need, we'd like to hear about that too. There's some support that we might be able to offer, and you know, or maybe there are things that you can think of that you'd like to ask your supervisor for, that sort of thing. So we'll just take a couple minutes and have you do that. Okay, sorry if I'm confusing people with the slides. I wanted to address a question about recommendations around bassinets, and we were thinking maybe this is the
slide. Yeah, there was a question about what do you recommend with bassinets, and saying that the slide really looked like it had bumper pads or was maybe the same material as bumper pads.
Okay. Yeah, so I mean, our recommendation for any of the sleep surfaces are that there's the mattress is sort of firm and tight fitting, and we do not recommend any sort of bumper pads. So I don't know, you know, and it is hard. We tried hard, but it is hard to find pictures that have all of the ones. So we know this was unsafe. Maybe that looks like bumper pads. I'm not sure. It's not. I think it's just the sidewall of a bassinet. So hopefully that didn't confuse too many people. But yeah, we do not recommend the bumper pads on the sides, and the bassinets shouldn't have anything sort of cushy on the sides. Okay, great. Yeah, so it sounds like we have more questions, so we'll start talking about those now.
Okay. So we have a question. Do you know of funds that will be available to families that cannot afford Safe Sleep?
So I assume that means can't afford a crib or a bassinet. You know, there's sort of limited resources for this. There is a Cribs for Kids program that's available in some hospitals, and I think they're trying to start one up in Salem, so that's one resource. I'd encourage you to call 211 just because it's hard to know what resources are available in each community, but 211 should be able to direct you to resources if there is one in your community. Pack-and-plays are a great sort of lower cost, safe option for families.
Great. We have a question. Is it okay to have babies sleep in the old style sleepers with arms and rounded bottoms that zip up?
That sounds like a sleep sack. So if you're describing a sleep sack, actually that's what's on the picture that's on the screen right now as a sleep sack. So if that's what you're describing, yes, those are still, their use is still supported. So that allows the baby to stay warm, but you don't have that blanket that could kind of cover their face.
Great. We have another question. In Oregon, are families sent home with boxes for newborns after birth in the hospital?
Oh, wouldn't that be nice? No, I'm afraid that is not happening. Like I said, there are a few hospitals I know operate a Cribs for Kids program, so I think it's through their social work department. They kind of identify families that don't have cribs, but there's nothing universal in Oregon.
Okay. We have another question about SIDS. Does thumb sucking reduce the risk of SIDS?
It's a good question. Yeah, we haven't seen that in the literature, but seems like it would have some of the same benefits of a pacifier use. But yeah, I have not seen that in the literature at all.
Okay, we had another question about the bassinet. It's the bassinet in the last picture. So possibly this one in the action planning slide. It does, maybe that's the one that looks like there are bumpers on it.
Yeah, I can kind of see that. Yeah, I mean, it's a little bit hard to tell now. I mean, the idea is that you don't want like a soft, like cushy, pillowy surface on the side that they could get their face kind of snuggled up into. So depending on how hard or soft that looks, that may or may not be safe.
We have a question about co-sleepers in the parent's bed. Are there recommendations around that?
You know, I don't know of any co-sleepers that have been recalled by Consumer Product Safety Commission, but I would go there first and look them up. If they haven't been recalled, I think I haven't seen anything that says they're not good.
Okay. Another question about recommendations on swaddling, if that has anything to do with.
Yeah, I think we've really confused families with swaddling because they see swaddling in the hospitals, and it is known to sort of help comfort babies. And then we tell families not to use blankets. So there are safer ways to swaddle. So you want to have you know, a thinner blanket, and you want it to be wrapped in a way that it's not going to get up near the baby's face. And there's another concern, kind of a separate concern about swaddling around hip dysplasia. So you don't want to have the baby wrapped so tight that their hips don't have a little bit of room to move around. You really, you know, and I guess the important thing with swaddling is if families are going to swaddle, they definitely need to lay the baby on their back every time. And, you know, I think people talk about the recommendation to swaddle only being around up until like 2 months, because when they get older than that and they can kind of flip themselves over, what you don't want is for a baby to end up swaddled without their ability to kind of use their hands or move themselves around when they're older and get them on their stomach and not able to flip to their back or move in a way that would make them safer. So I would say those recommendations are a little tricky, but there are safer ways to swaddle, and you don't want to swaddle, you know, until they're a year old or anything.
Thank you, Anna. So we have a question about sleeping in car seats. Can we address this? Should babies ever sleep in car seats?
Yeah, I think that's tricky because I think everybody knows that anyone that's had a baby knows that babies will sleep in a car seat. The idea is that you do not want to use your car seat as the place where your baby sleeps. You don't ever want to lay your baby down to sleep in your car seat, and you don't want to like leave a baby there like all night once you get home because the baby's sleeping. You still want to take the baby out of the car seat and put them in a safe sleep environment.
Great. We have another another question about sleepers. In this picture, on the action planning side, the sleeper doesn't have arms. And is there any concern with a sleeping garment having arms causing overheating?
No, not that I've heard of. No. I think they would be, yeah, I think they would, you know, most of their warmth comes from like sort of the center of their body anyway, so I think one with sleeves would be fine.
Great. Someone else asked if there is an example of a co-sleeper in a parent's bed.
Yeah, so I guess I'm not totally clear if someone's asking about, there's something that are called an arms reach co-sleeper that looks similar to this. So it has, it kind of latches right up to the parent's bed. I think those are the ones that Adrian's talking about. There are, I think, also little like boxes that sit in a parent's bed, and we don't have a picture of that. So this would be another, this is similar to what Adrian's talking about. Those ones that sit in their beds, I have never seen that those recommended. So I think the recommendation is a separate sleep surface, so something that's not in the parent's bed, but near the parent's bed. But I think I do know what you mean. There's something that like sits like actually in their bed, and those are not the ones that we recommend. The ones that we recommend are sort of like next to the baby's bed, but they have their own sleep surface.
Right. I think they slide between the mattresses.
Okay, another one about car seats. There have been instances where babies are left in car seats when they are dropped off at daycare and have suffocated from having their head tipped down. Should they be moved after a certain amount of time?
I mean, I think the recommendation is really when you get where you're going. So, I mean, I think that would happen with very new babies. But yeah, when you get to the place, so at the child care, in this case, you would want to take the baby out and put them in a safe sleep environment.
Great. We have a couple pictures about couple questions about babies moving. What do you do about babies that roll onto their tummy at an early age before the age of 1? And then what about babies that like to stick their arms and legs out and could get stuck in a crib, I'm assuming?
Okay. I mean, so I would just stick with the recommendation as you talk to families to put the baby on their back every time you put them down to sleep. We do not recommend that families like wake up, I don't know what you'd have to do, every couple hours and turn a baby over. But when you're putting a baby down to sleep every time, and so newborns are, you know, are the ones that are most likely to be waking up a lot, and you would need to continually put them back down on their back to sleep. A baby that, you know, is over, you know, is 5 or 6 months old, which is the typical time where a baby would be able to turn themselves over, then it's thought that they sort of have the strength to keep themselves in a safe place. So you don't need to continually turn them. So it's really those newborn babies that are up you know, every couple hours. You need to, every time you're putting them to sleep, put them down on their backs to sleep. I feel like there was a second part of that I'm not sure.
That was great. There was a question about if babies move their arms and legs getting stuck.
I haven't really seen that as a concern. I mean, and I guess that's a place, you know, if that is a concern over age 1, and this is something else you could talk with families that really, really love their bumper pads that, you know, maybe their grandmother gave them for their baby shower, is that after age 1, we're not so concerned about the bumpers. So if this is a baby over age 1 that is getting its arms and legs through the spots, because that's when babies, I could picture them being big enough to move around that much. After age 1, if families like the idea of bumper pads, they could use them. All right, thank you for all the great questions. I'm going to check in and see if we have.
There's just a lot of questions about the resources and where to get them, and the link's not working here, so making
Oh.
sure that we send out.
Okay. Sorry, that link's not working. Sorry. Okay, we will. Yes, we will make sure that we get you the right link so that you have access to the brochure. I also have Michelle's contact information. So Michelle's who you can go to actually order hard copies of both the brochure and the prenatal and newborn resource guide. My contact information is there. You are welcome to contact me if you can't find that link on our webpage. We'll send, let's see. I think we're going to send, oh, you're going to get an evaluation after this, so that might not have the right link. But we could send out an email to everybody with these slides, and we can have a corrected link if that one doesn't work. And then I just wanted to make sure that for DHS staff, that you know that Jennifer Weinhausen is sort of our champion. So if you're from DHS and you're thinking about how you could implement this in your self-sufficiency office or how this might work, she's a good contact for that. So that's why she's listed there.
We're asking about the certificates here.
The certificates. Okay, so, oh yes, this is, I knew there was going to be a way we were contacting you. We're going to email you after the webinar today or tomorrow, and we'll have information about how you get your certificate, and I'll make sure we have that corrected link, and we'll send you out the handouts. So we have, if you registered today, we have your email, and you'll be getting that information from us.
There was another question about if there are any videos around safe sleep that they can share during the enrollment process.
Okay. Videos around safe sleep. We have started to see some of those. Wisconsin has some, and we just reviewed one from somewhere else. What we think we want to do is get those up on our web page, that same one that apparently is the wrong link, on the Public Health Division Safe Sleep page. We're going to try to update our resource list to include some videos. But if you need something soon, you could feel free to contact me, and I can share the ones I know about. All right. I think we have gotten a lot of our questions answered. Okay, so yeah, we can. So we've sort of been going mostly based on reading people's going back and forth between the terms co-sleeping and bed sharing. And we feel like in order to be sort of clear about what we're talking about, we're using the term bed sharing. So we're trying to talk about bed sharing when an infant is in a bed with its mom or dad or another caregiver or another child, instead of using the term co-sleeping.
Right, because the co-sleepers are an actual product, so it can be confusing.
Yeah, and I think that did happen a little here. So yeah, so the co-sleeping product, which actually can be something that is recommended because it can be next to the parent's bedside. So that's why we stopped using that term, and we're talking about bed sharing because it seems like that's the most descriptive. All right. Well, thank you, everybody, for spending the last hour with us. It was great to have so many people join us, and feel free to contact us if you have questions or there were items that were confusing or you want more information about.